Cancer is something that will sadly affect many of our lives, whether it be ourselves or a loved one, and an early diagnosis can make the difference between life and death. So, how can we make sure that this happens?
Well, one idea from Health Secretary Jeremy Hunt is to publicly name and shame GPs who reportedly fail to spot the early signs of cancer. Joining us now to discuss this, plus what you can do if you're worried about the treatment you're receiving, is GP Dr Jonty and Ali Stunt, who is the CEO of Pancreatic Cancer Action and was wrongly told she had IBS when she was actually suffering from cancer. So welcome both.
Welcome.
Let's discuss the proposal first of all. Jeremy Hunt, the Health Secretary, has vowed to root out doctors who cost patients lives by failing to send them for vital hospital tests soon enough. The GPs will face a system whereby they would be ranked either green for quick referrals if a patient's shown signs of cancer, or red if they miss too many cancer cases. He told the Mail on Sunday, cancer diagnosis levels around the country vary significantly and we must do much more to improve both the level of diagnosis and to bring those GP practices with poor referral rates up to the standards of the best. Good idea? Good proposal?
So yeah, I think actually it's that last bit that for me is really important, which is that actually there are variations across the country, and Mr Hunt's right to raise that. And what's important is to identify why those variations exist and to support those practices that perhaps aren't referring as many patients to understand how they could do better. So I think at its heart, absolutely. I think naming and shaming, from my own perspective, isn't the best way of supporting GPs to do better. And I think we also need to understand much better why it is that diagnoses are being delayed, because we know there are many factors that contribute to it, and sure, possibly not being diagnosed early enough by a GP is one of them, but we talk on the show a lot about the fact that patients don't always recognise the symptoms early enough as well, and why that's so important. So there's lots of kind of elements to this, so I wouldn't personally think that naming and shaming is the right approach.
Isn't there a worry that if you name and shame a practice, then rather than being named and shamed, what they're going to do is over-refer? So you're going to get hospitals full of appointments being taken up by people that are just checking, just to make sure they don't end up on this list.
I think that's exactly right. So for me, when I've been thinking about this, I think there are two key risks. So one of them is exactly that. So as a GP, if I was worried that I was going to be named and shamed, then potentially I'm just going to start referring any patient with a symptom that might possibly be cancer up to the hospital. That could delay people who do have cancer from being seen, because of course the clinics are going to be inundated by patients who are actually healthy. The other risk is that actually a lot of people would be unnecessarily investigated. And we don't talk about this a lot, but we know at the moment, for example, that GPs referring patients urgently up to the hospital, only about 1 in 10 of those patients will turn out to have cancer. So 9 out of 10 people are having investigations they don't need. Now, if it's just a blood test, I guess that's not the end of the world. But actually some of these investigations are in themselves or potentially quite harmful. Colonoscopies, X-rays, that sort of thing.
It's bringing us into line with other European countries.
Yeah.
And Britain lags behind these countries when it comes to cancer survival rates. The main reason is late diagnosis. If Britain's cancer survival record matched the European average, at least 5,000 fewer people would die of the disease in the UK each year. That's the Department of Health Improving Outcomes source in 2010. So surely it's right that we should get to grips with this, get to grips with it quickly and severely, because 5,000 people have died unnecessarily.
Yeah, of course, Philip, you're right. I mean, we've got to focus on this, and we've got to improve people being diagnosed earlier and therefore potentially being cured of cancer. There's no question about that. I think what we're talking about really here is the methodology is the best way of doing that. So is it through naming and shaming GPs, or is it actually through a number of other ways? So supporting GPs and educating them more effectively, and I know Ali's doing a lot of that in her charity. But also, I think, recognising that a lot of the ways in which we diagnose cancer at the moment are quite blunt tools. So we're not particularly accurate in our diagnosis. The symptoms that we talk about on this show a lot often don't accurately pinpoint people with cancer. So there's a lot of work to be done at the moment in helping us to predict who is more likely to have cancer and make sure that we actually make that diagnosis much more accurate. So I think there's a lot to do. You're absolutely right.
Well, Ali, let's come to you, because you started your charity in 2010 following your diagnosis with pancreatic cancer. The diagnosis came much later because initially it was missed, wasn't it, by the GP?
Well, yes, I went to the GP on a number of occasions, and I was told that the symptoms that I was presenting with could possibly be irritable bowel syndrome, so I was told to go to the chemist and take a over-the-counter remedy, and also indigestion as well, so I was again told to go and take an over-the-counter remedy. I had escalating pain and I knew something wasn't right. And I was one of those people who didn't go to the GP very regularly for myself. For my children, yes, but not for myself. So I was one of those rare attenders that was suddenly in the GP surgery once a week. And yes, my symptoms were missed, and I think it's probably down to the fact of my age as well, because being 41 at my diagnosis, I was quite young to have pancreatic cancer. But ultimately, the pain was escalating, and I took myself off to A&E.
Well, the thing, A&E sent you back, didn't they, eventually?
Yes.
So this is continually wrong by the GP, and you're in increasing pain. And the fact that you are sitting here today is almost certainly down to the reason that you then hopped onto your husband's private health care and you fast-tracked yourself.
Absolutely.
And if you hadn't done that, then this misdiagnosis would possibly have killed you.
I wouldn't be here today, and my surgeon has actually said that had I waited the 4 to 6 weeks for an ultrasound scan on the NHS, which I was going to have to do because cancer wasn't suspected, then I probably wouldn't be here today because I wouldn't have been operable.
So the big question is, I mean, what do you do? What do you do if you feel you're not getting the care that you need? What about if, like you're saying, I'm hearing the doctors every single week, and every week they're sending me home with an over-the-counter remedy? What do you do? What's the best thing to do?
Well, in my opinion, I think you've got to do what I did and just keep going back. And I think the onus is on us, the patient, as well as the GP. I think we do have responsibility for our own health, and we know our bodies better than anybody else.
Pancreatic cancer is notoriously difficult to spot, isn't it?
Yes, but there are, I mean, people say it's a silent killer, which is wrong, because we know that patients will have symptoms sometimes up to 2 years before their diagnosis. And well, I know of a lady who went to her consultant surgeon very recently, and he told me that she'd been backwards and forwards to her GP for over a year. And in the end, she was told, look, you know, this is all in your head. And she's now got inoperable pancreatic cancer, and the prognosis is not brilliant for inoperable
So he
cancer.
should have a flag. He should have a red flag, because he's not doing his job properly.
So, well, because you need to understand more about why the diagnosis was missed. But I think so the first thing that you've pointed out quite rightly is a lot of symptoms of cancer, and pancreatic cancer in particular, are symptoms that actually occur with lots of other illnesses as well. So abdominal pain, tiredness, weight loss, these are symptoms of cancers that actually it's really hard as a GP to particularly in the early stages, to identify as being due to cancer. But I absolutely agree with Ali that one of the most important things is to keep going back to the GP, because actually often symptoms evolve, and mostly as a GP, if I'm seeing a patient 2 or 3 times, I'm then starting to think, okay, there's something here that isn't quite making sense. I've done some tests, or you know, I've tried some treatments, but actually things aren't improving. So one of the things that I think is really important to do is to go back and see the same GP and tell them what you're anxious about, because actually very often if you say, well, what I'm really worried about is I saw this article and I think I might have a cancer, then the GP can effectively reassure you if they don't think it is, or it may even prompt them to seek some advice themselves. So I think there's something there about going back and seeing the same person if possible. But of course, if you're not happy with the advice you're being given, see another GP. Most practices now have a range of different GPs there. Make an appointment with someone else to get a second opinion.
Part of the problem with my case and with other people is that you don't get to see the same GP. We've got multi-GP practices now. So you're not developing that relationship, that rapport, which would probably help where the GP's instinct in terms of, well, I saw this lady last week and she's really not looking good today, and therefore the suspicion perhaps that it might be something very serious can be acted upon.
Do you think, just finally, that there should be a red flag system, that if quick referrals, patients showing signs of cancer, you get a red flag if you repeatedly miss it?
I think there needs to be a system of being able to identify GPs who are not referring and not referring consistently across all cancers. And I think we need to be able to identify those GPs who are doing very well. And we need to use that as some kind of benchmarking situation where we can actually get those poor performers to actually raise their game and start to refer a lot better in the future.
Thank you both. Thank you very much.